Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I want to tell you about a case of a patient actually that I have seen perhaps 6 or 7 different times over the past 2 years. He doesn't come often. He lives pretty far outside of Buffalo, New York. And he only comes when he's in a lot of pain. He's a retired firefighter, late 50s, I think. And he originally came to me with a lot of chronic pain. I did a lot of trigger point work on his upper mid-back area to get him out of chronic pain. Of course, he had typical low back issues, and but all of it was resolved. I think the first time I had to see him, I saw him for about once a week for about 3 visits, and then we went to occasionally as he could make it in. And recently, he reached out because he was having some neck pain and headaches and tinnitus, and he wanted to see if I could help him. And I said, I'm not positive that your tinnitus is coming from neck muscles, but based on your history, I think it's worth me checking it out and seeing if that's something I can help with. I can certainly help with the neck pain and hopefully headaches, and the headaches are probably related to the muscles that are also causing tinnitus, like the SCM and suboccipitals. Anyway, so while he's there, he tells me about the burning pain. He says, "Can you do something about the neuropathy in my feet?" I said, "How long have you had it?" He said, "For like 20 years. I said, "But you never told me about it." He said, I didn't think anything could be done about it. And I think it started after he had been on a couple rounds of Cipro. I won't go into his whole health history, but he almost died from sepsis. He felt like the Cipro was kind of like a turning point in his suddenly having a lot more myofascial pain. And if you look into it, it's a known side effect of Cipro, especially for people where it's been used more than one round. Chronic myalgia, chronic tendinopathy. So a lot of people know about the Achilles tendon rupture, but chronic myalgia is something that you'll see. And I've had several patients who felt that Cipro had led to them having chronic myalgia. And in most cases, you really need to do a lot more trigger point work. It's not a simple reset of tight muscles. They've developed a lot of taut bands in the muscle. Perhaps that's the etiology of the Achilles rupture. Perhaps something about Cipro is creating muscular bands, taut bands, that's making the muscle a lot less flexible, more prone to a tendon rupture. So it's something interesting to watch out for. But I had a patient in New York who had chronic myalgia and pretty much felt the only thing that helped him was working on myofascial trigger points. So anyway, back to the patient that I'm talking about. He messaged me today because he said he's had the best night's sleep he's had in 20 years because he wasn't woken up every 2 hours with muscle cramps in his legs. He had like numbness and burning in the anterior low leg, the shin area, top of the foot. And my assumption was, and of course, I will work up the chain eventually, but I like to nail down the diagnosis first. So I put pressure on many of the locations where I would expect a superficial peroneal cutaneous nerve entrapment about 5 centimeters up from the lateral malleolus in front of the peroneus brevis, usually. Nothing there, no sensitivity in the peroneals, not much sensitivity in the extensor digitorum longus anywhere, not much sensitivity in front of the lateral malleolus, like in that extensor digitorum brevis area. So he didn't really have symptoms of a superficial peroneal nerve entrapment, and I stretched the area to see if it recreated any, and it really didn't. But then I was thinking, okay, he gets leg cramps at night. What if it's more of a sural nerve issue? Because that distribution is very similar. It's more lateral. It goes down behind the lateral malleolus into that Achilles area. The entrapment can be anywhere along the pathway of the sural nerve, and there are a couple branches. One comes off of the peroneal nerve, and one comes off the tibial nerve, and it's a sensory nerve only. And he had on both sides really noticeable, painful areas of trigger point in the lateral gastrocs on both sides. Maybe more on one side. On his more symptomatic side, I did find more of those entrapments. So I released them with a motor point with a stimulation with electric stim, but after a few minutes, I took the needles out, and the pain was still the same. So I decided to do some trigger points, and he was totally on board with it. And I got really good twitches out of those areas, and then was able to come back and find out that they were deactivated. And I said, I'm hopeful that this is the right way to go, but we really probably need a few sessions because this has been chronic for 20 years. And I don't expect a miracle here. We just have to, keep working on it. Every time I see you, we keep working on it. And we'll consider up the chain anywhere where there could be some irritation of the sciatic nerve, like the deep rotators, etc. So anyway, he messaged me that he slept ever since the treatment, he's had no leg cramps at night, and he slept through the night. And that's like the first time in 20 years that he's been able to sleep through the night with no leg cramps and burning. He would get burning and tingling and numbness in that distribution. So it wasn't just burning, it was also a numbness and tingling, worse at night. And it seemed to be, I thought, worse at night because he was getting leg cramps, the leg cramps pressing on the sural nerve. But I'm now starting to think maybe the etiology of the leg cramps was actual sural nerve entrapment causing the muscles to cramp up. So regardless, he's very happy. I'm very happy. Definitely worth looking at. I'm teaching the sural nerve entrapment in Sydney end of March. I'll put the registration link for anyone who's in that part of the world and wants to come. I think we have 2 or 3 seats still open. That wasn't in the original outline, but when I outline a class, I really, it's usually many, many months in advance. And then over the course of putting the material together, I change my mind and add things and change the way I'm presenting things. And, I have to keep it fresh for myself and also improve upon how I was explaining things before. If I look at a slide that I made a year ago or 2 years ago, and it's not immediately clear to me what I was saying, then I need to fix it, make it make more sense, add an image. So I've been updating, I was updating a lot of slides, and I started thinking, why am I not teaching the sural nerve? Because the superficial peroneal nerve is very, very important for foot neuropathies. But, every once in a while you see somebody where after sciatica, that outer part of their pinky toe is still numb. And that's more likely going to be a sural nerve thing than it is going to be like a lateral plantar nerve thing, because they're not usually numb, like really underneath the pinky toe, and it's not really the same distribution. So you'll see it more like lateral part of the foot that has some numbness, and that's more likely like a sural nerve type issue. So I thought, well, I've got to put this in. It's just got to be complete because I see it enough and I treat it enough that I don't want to leave it out. It's important. Because it's great to get somebody out of chronic sciatica, but then they still have that one little bit that's not quite right. You want to like give them that last bit of improvement, and it's often the sural nerve. So that's been added. One other thing that I added was the abdominal cutaneous nerve entrapment syndrome. Really, really overlooked very often. Missed very often, and people end up suffering with these missed nerve entrapment syndromes for years, sometimes before somebody recognizes what's really going on. So, as acupuncturists, we end up being the last resort of the hopeless, and it's important for us to be able to recognize some of these things so we can give them a solution quickly. Many times these cutaneous nerve entrapments resolve very well with the use of motor points and trigger points and the areas of entrapment, and in general, just resetting an entire muscle so that there's less tension that can affect the nerve and fascia. So I wanted to share the sural nerve thing, and I'll put the link to the registration for the Sydney course for anyone who is in that part of the world and wants to come. Like I said, I think we still have 2 or 3 spots still open, and then that will be recorded, and I will be putting it on Podia for people to have. On my Podia site, the online courses. So, and it's the first, I think it's the first course. It is the first course that I'm doing where I'm covering this many nerve entrapments. I always cover a few. Last year's Sydney course covered some nerve entrapments that I will also cover this time, but this is a lot more extensive, and I think it'll be useful. And if I get good feedback, then I may just create one online course where I discuss all the nerve entrapments just to help people recognize symptoms, entrapment zones, treatment protocols, etc. Hopefully there will be an interest. And so that's it for now. You may not hear from me for a couple weeks because I'll be abroad. I'll spend 1 week, one weekend traveling, and then the next weekend teaching. So I will probably be speaking with you in April. Okay, take care.